Good morning. Thank you for being here. On February 7th, the U.S. Department of Health and Human Services began transporting American citizens evacuated from the Hubei province of China, and Joint Base San Antonio, Lackland Air Force Base, was one of the 4 designated quarantine sites. We are here to notify you that the Centers for Disease Control has confirmed a case of the coronavirus, properly called COVID-19, in San Antonio. The risk to the San Antonio public remains low, and I want to stress that the individual has been quarantined since arriving at Lackland Air Force Base from the Wuhan province in China, and the individual remains in isolation in a local hospital. Of the 91 passengers at Lackland, this is the only patient with symptoms at this time. The public health emergency preparedness has gone exactly according to plan. Our local, state, and federal partners, each of whom are represented here today, are coordinated in executing the plan to treat the individual and contain the virus. You will hear momentarily from Captain Jennifer McQuiston from the CDC and Dr. John Hellerstedt from the Texas Department of State Health Services. We also have with us Assistant City Manager Dr. Colleen Bridger, Director Don Emmerich, and Dr. Anita Kurian from our Metro Health Department. Representatives from each of our major hospital systems are also here. I'd like to recognize Alan Harrison, Methodist Healthcare, Dean Alexander, Christus Santa Rosa, Dr. Brian Alslip, University Health System, Matt Stone, Baptist Health System, Eric Epley from the Southwest Texas Regional Advisory Council, Bexar County Judge Nelson Wolf, San Antonio Fire Department Chief Charles Hood, as well as representatives from Congressman Joaquin Castro's office. And I do want to say thank you to our Bexar County congressional delegation for hosting us in D.C. to get an update from CDC and HHS just last week. The system worked precisely from the quarantine, which allowed professionals to identify the symptoms early, to treat and transport to the hospital, which was done in a dedicated ambulance by EMS professionals who are specially trained in treating infectious disease, to the hospital, which is treating the individual in a room under maximum level of isolation. I want to repeat, every precaution has been executed according to plan to keep the individual isolated from the general public. San Antonians should feel confident and continue to go about their lives while health professionals treat and contain the disease. We will not be releasing any information about the patient or the hospital where the individual is being treated. So now I'm going to hand off to Captain Jennifer McQuiston, who will talk about the process in confirming the case of COVID-19 and the exposure assessment at Lackland Air Force Base. Captain.
Good morning, everyone. Thank you for joining us, and I know that you're here because you're very interested in making sure that the right information can get out to your viewers and to the public. So as you know, CDC released a media statement this morning confirming the 15th case of COVID-ID in the United States. As the mayor mentioned, this patient was part of the passengers that came into JBSA Lackland, and they have been quarantined. They were issued a 14-day federal quarantine order, and we are tracking February 20th as day 14 for that group of people. There may be additional cases that we identify. I do want to prepare you for that. We're still within the potential incubation period for coronavirus for people coming out of Wuhan city in China. We continue to monitor these passengers every day, twice a day, with temperature checks. We're looking at symptoms. And the moment we suspect that anyone might have coronavirus based on their symptoms, we will immediately use the exact same system to send them to the health centers that will be able to care for them properly and keep them isolated. I really am very pleased to be part of this response. It has been wonderful to work with everyone, and how seamlessly it all went, I think, is a testament to the fact that we've been preparing for this since day one. Federal quarantine is working. When we find someone in quarantine or are able to keep them isolated, that is the entire reason for it. So now I'm going to turn it over to Commissioner Hellerstedt, who is going to have a few words for Texas.
Very good. My name is John Hellerstadt. I'm the Commissioner of the Texas Department of State Health Services. And I'd just like to really reinforce the messages that you've heard so far from the Mayor and from Dr. McQuiston. And that is, we have prepared for just this sort of eventuality for a long time. We've done it at the national level, the state level, and coordinated with our local partners. And what you see in front of you is that system working exactly as planned. So the steps that have been taken and the actions that have been taken are exactly those needed to protect San Antonio, Texas, and really the rest of the nation. So we can really feel confident that this system worked very well in this situation. So I really like to thank San Antonio for having this opportunity to convey this information to you folks. I want to assure you that we have ongoing and very close coordination and cooperation with the CDC at my level, at the state, the Texas Department of State Health Services, as well as our city and county local health departments, including your San Antonio Metro Health Department here. We share information on a daily basis. We make sure that we understand the situation the same way, and we make sure that we get the message out to folks that is a consistent message. That's extremely important because obviously people are concerned about this virus. They should be concerned about this virus, but they have steps that can be taken. It's a virus that's similar. It's in a family with many other viruses, and the kind of things that we've been telling y'all to do all along to protect yourself against the flu are exactly the kind of things that will work in this circumstance. So please understand that message, amplify that message for the folks that you talk to and that you interact with. Use the websites that are at the CDC, at the Department of State Health Services, and at the city and county local health departments. They're really all linked together and provide excellent up-to-date information. And go ahead and take those steps that people can take. They protect themselves from every kind of germ. So hand washing, covering your cough with your sleeve, washing your hands, I said that twice already, using hand sanitizer if you don't have access to soap and water, stay home if you're sick, and disinfect the frequently touched surfaces. Those things work. We know that those work against every known germ that's out there. It works against this virus as well. So with that, I'll really kind of conclude my remarks and turn it back over to the Mayor. Thank you.
Okay, excuse me, and I mentioned the folks who are here today, so at this time we'll take any questions that you have.
Mayor, with the people who are being self-quarantined, are you guys going to be doing more now that there is this confirmed case?
Dawn, you want to take it?
No, I need to do it.
Anita?
So as far as the, I'll let Captain McQuiston answer the CDC response, but as far as the local community here goes, no, nothing has changed for us. The risk at this time to the community here is still considered low.
So everyone who's involved in the response to take care of both the passengers who's come in and the passengers who have come in and the patient who is at the hospital, they're wearing personal protective equipment that will protect them against exposure. Everyone involved in the response is also monitoring their temperature twice a day, checking in with their teams that they're working with. So we are being very careful. Even though we are taking the precautions and wearing the personal protective equipment, we're still monitoring them.
Dr. McQuiston, what's being done at the Lackland quarantine right now? We know one of these people who was evacuated now has it. What's being done to make sure that there are not more people in quarantine that this is going to be spread to?
So I'm happy to tell you that I was able to share this information with the people who are still in quarantine today. They were very grateful to get the information. For the most part, the people in quarantine are not doing much associating with each other. They're staying with their families in their rooms. They are a little suspicious of each other. They're starting to get to know each other, but all of the activities that we have where we announce new information, they're all outdoors so that there's less of a chance of spread when you're not doing those things indoors. And they're staying strong. They want to come through these 14 days so that they can get back to their family and their loved ones and not risk spreading this virus to them.
Was this person alone in their room?
This individual was a solo traveler.
And you said they're outside now? Is there a concern because they're spending time outside that the virus might be able to spread to to the greater Lackland area?
No, so as I mentioned, we're monitoring everyone's temperature twice a day and we're looking for symptoms. And this virus is known to mainly be spread through small droplets by coughing, and those droplets don't spread very far through the air.
Doesn't the public deserve to know what hospital this person was taken to?
I understand that people are curious, but for the safety of the patient, CDC is not releasing the name of the hospital.
Could you elaborate a little further as far as why we should expect perhaps the eventuality of other cases and how we should be prepared?
Sure. So an incubation period is the time from when a person is exposed to virus till they develop symptoms. The 14-day quarantine period is designed to cover that period of time. So I think we're on day 7 of quarantine now. So we are right in the middle of that potential incubation period. So it is not surprising that maybe someone would have developed symptoms in this time frame, and we're going to continue to be watching people during the whole 14-day quarantine period.
Does this extend the 14-day quarantine period?
So at this time, I don't have any information from CDC saying that we would extend it. We are going to do a very thorough investigation of where this patient went when they were inside quarantine, what the room was like, who may have gone in and out of that room, and we will be monitoring those individuals.
How was this person transported from the base to the hospital? Was it a city ambulance or a private company or what?
Does the city want to take that question?
Good morning. I'd like to first thank the people behind me. This is a team that has put together a wonderful template that I think will be used in other cities around the country. So between the federal, state, local partners, the city, we have done a really tremendous job as far as informing one another and having a plan set forth. So I can assure the citizens of the city of San Antonio that this is a special infectious disease response ambulance. It is dedicated to this event throughout. It will not be used on the streets of the city of San Antonio. Also, we have over 30 members. The first team in the state has been dedicated as an infectious disease response unit. So that happened in 2018. So we had the team in place. With the help from the state, this ambulance is dedicated for this mission only. And we stand by, we're flexible, but again, the citizens should expect the tremendous care that they receive every single day. This is not going to change that. Thank you.
Back on the subject of being self-quarantined, do we know if any of these people have siblings, spouses? We've had a couple reach out to our newsroom saying that there's a professor at UIW who is still able to attend the university even though his wife is being self-quarantined.
So I'm not familiar with that particular situation, but I can tell you that the quarantine that people are in here at JBSA Lackland are based on their exposure back in China. So that is what they are being quarantined for. People who may be married to those individuals or family members of those individuals who have had no contact with them are not at risk to the public. We are keeping them in quarantine so that when they're released, they no longer will pose a risk to their loved ones.
I mean the people who are quarantined.
The people who CDC has quarantined or local, state, and
Yes.
So as long as someone is healthy and not having a temperature or exhibiting symptoms, they are not at risk for transmitting that virus to their loved ones. So while they may be at home, their loved ones are not restricted for their movements.
We know that you cannot release the name, but some details about the patient, male, female.
So we're not going to be releasing details about the patient. I know everyone is very curious about it. Just know that they are receiving excellent medical care. They were, of course, not happy to learn of their diagnosis last night. And they do have loved ones in the United States that they are in contact with by phone, and we wish this individual well.
Can you share a little bit of the timeline when they displayed symptoms, what symptoms they were, and then when the test was positive? Because I understand it takes a little while for the test to actually go through and get positive.
This patient was identified as having a fever the morning of February 11th. And they were transported to the hospital that morning, and samples were taken and sent to CDC overnight, and we received the result about 6 p.m. last night. So it was a little over 24 hours from the time we identified the patient with a fever, and they were taken to the hospital till we got the test result back, which is great to have it turn around that fast.
Did the evacuation, did bringing this person here to San Antonio save their life?
I think that's a really good way to look at it. If you look at the situation in China, it's challenging. I think a lot of people are avoiding going to hospitals there even when they need care because they're worried they could get coronavirus when they go there. To have these American residents be back safely in the United States so that when they get sick, they can get the great medical care that San Antonio has to offer could very well save their life.
Can you talk just a little bit, the rest of the folks there, you've got 90 people who are still on the base, they've 9 more days that are there. How are they doing and looking forward? I mean, it must be rough. I mean, they came from China, and when your flight gets delayed, it's a hard day.
Yes, they've had a tremendous flight delay. They're in good spirits. When I talk to them, they are so incredibly grateful to be here, to be in a community where they know that if they need medical care, they're going to be able to receive it. They understand why they are in quarantine. They do not want to spread this virus outside to their family and loved ones. They, of course, are counting down the days. They're finding ways to keep busy. They're online with their own electronics. Some of them are taking classes. They might be university students back in Wuhan, and they're still trying to learn. They might still be working remotely. So they're trying to carry on life as they can behind the fence, as we call it.
True that someone wants to escape from that.
Well, I'm sure that if we told them that they were safe and their quarantine was over, they would be ready to go at any moment. But no.
Can you tell us anything about who the evacuees are who are being held at Lackland? We haven't really heard about like what their connections are to the U.S. Like, are they all American citizens?
So I don't have details on everyone. I can tell you that they all had American connections. So maybe they were married to an American, or they might be permanent American residents, and there are 91 of them, so they run the entire spectrum of that. Some of them are very strong English speakers. Some of them have communications challenges, so we have translators on site who are helping us communicate with them carefully. The important thing is to make sure that their needs are being met, they're comfortable, that their health care is there for them. We have a wonderful medical team made up of our DMAT folks, our disaster medical assistant. Do I have the right DMAT? Disaster medical assistance teams that are here forming the core of their immediate health care needs in the facility. If they have prescriptions that need to be refilled, if they have chronic health conditions, their needs are being met there. And then if they have symptoms of coronavirus, of course, then they are transferred by EMS to the hospitals where they can receive extra care.
What kind of treatment is there for these folks, for those who have been diagnosed with antibiotics? People may wonder what do they do with antibiotics, for instance.
So this is a virus, and we don't really have a known proven antiviral that can prevent the virus from spreading in the body. But these individuals also have often what is known as pneumonia, and so you can definitely offer supportive care for patients who have an illness like this to help them be able to breathe comfortably, to make sure they have oxygen, to keep their fluids up. So those are the kinds of supportive care that would be offered to any patient with coronavirus.
We know that test kits were shipped out to state and international labs, and the CDC has said that some of those kits are flawed. Is that the case for the kits that were sent to Metro Health in the state lab here?
So CDC very rapidly developed a test to enable state health department laboratories to be able to test for coronavirus here. As part of that process, the states needed to use the kits in their own hands and validate that they were working, which was an extra step to make sure that everything was in place. And during that process, that step, they found out that one of the controls was not working well. So these test kits were never used on patients at this point. This was just the process of making sure everything was working right. So as soon as states identified that, they notified CDC, and they're correcting it to make sure that the right kit ingredients are going to get out to states. And it's only when those kits are working properly will they begin to use them on patients. For now, anybody with suspected coronavirus has specimens that are sent to CDC for testing, and the tests being run at CDC are working well.
Doctor, there's going to be some people out there who will hear this story and get angry. They'll say, I'm angry that the coronavirus was brought here to our community, and they don't think it should have been brought here to the community. What do you say to those people?
I can understand how community members may have questions about about why this happened in their community. But I think it's really important to also have empathy for people who might be caught in China, who should be in America and cannot get back. And think about what it would be like if you or a loved one was over there and what you would want us to do for them. We're Americans. We bring our people home and we take care of them. And that's really what lies at the heart of this mission. And I would say that because we know people have questions and we know that they can be confused, that's why this 14-day federal quarantine order was issued, so that we could ensure people that this was going to be done safely.
Could someone from the city about antidote or any kind of vaccine developing or something?
I do know that scientists are very busily working on whether there could be antivirals that might work, whether they're developing a vaccine. But for me, I've been very focused on the day-to-day operations here in San Antonio, and I don't have the latest information on what CDC and NIH may be doing on that.
May we hear from the council member representing the Lackland area, just to get some feedback from the council member about what they'd like to say to their constituents?
I'm happy to answer any questions that you have.
Very good. Would you speak to those constituents who live and work in that area?
Yeah, what I would say, the bottom line is that the emergency preparedness has gone exactly according to plan. It's a collaboration between the CDC, HHS, the state, and local health. And San Antonio residents should have every confidence in the world that they can continue their lives on an irregular basis. The individual has been quarantined exactly according to plan, and they will continue to monitor the situation.
Metro Health, could you give me more details about self-quarantine? They check in twice a day. How is that? Do you go there? Do they call you on the phone and say, hey, my temperature's fine? Like, how does that work?
So that's different from what's happening at Lackland. So here in the community, we are having travelers returning back from mainland China outside of Hubei province, which was the epicenter for this infection or this outbreak. So we have travelers who are U.S. citizens, permanent residents, and their immediate family who are coming back to their communities from mainland China, and they are screened vigorously before they leave China. They're screened again while in flight. They are screened again at the ports of entry. They are funneled through 11 airports across the nation. They are screened once they deplane at their port of entry, and then that information is transferred to the appropriate local health department. So anybody coming back to Bexar County, we get notified of those returning travelers, and as soon as we get notified, we reach out to them and do a risk assessment. So there are strict CDC guidelines placing these returning travelers into certain risk categories. We do a thorough risk assessment, and based on those risk assessment, recommendations are given. So I can tell you this much: all travelers who have returned back here have been found to be medium or low risk, and we have been in contact with them every day. They are asked to take temperature and their signs and symptom monitoring twice a day and report it back to the health department promptly every single day. And we will be following each one of those returning travelers for a period of 14 days from the time the wheels were up in China.
Do they self-quarantine for their families, and are their families allowed to?
Yes, so like I said, because most of the travelers were in medium and low risk, they are self-quarantining. They're isolating. They're placing themselves under quarantine at home. Like Captain McQuiston had alluded earlier, these are asymptomatic folks. The primary driver for this infection is when the person becomes symptomatic. So at this time, all of them have been deemed to be asymptomatic. They're staying home. They're not going to work, not going to school, not planning on traveling anytime soon. They are staying home and following our guidance.
Could someone address the disinfecting process as far as disinfecting, for instance, the ambulance, the rooms where they're staying, the hospital rooms? What kind of disinfectant? How do they do that?
Do you wanna?
With respect to how to disinfect after a person with coronavirus may have been somewhere. CDC does have guidelines recommending how that disinfection can occur, and there are many EPA registered disinfectants that are approved to kill coronavirus, and so there are a variety of products that can be used, and so making sure that any contact surfaces are treated with disinfectant, that you've got it on there for enough contact time, those are the sorts of things that would be applied in those circumstances.
You can get at the grocery store, Clorox, bleach.
I will tell you that my area where I work there has Lysol wipes everywhere, and that's what I'm using.
So I have a question about the folks that are in the 14-day quarantine. You addressed it a little bit earlier. What would it take for the 14-day quarantine to be reset? Because I know in some cases when some new person is like on the cruise ship, for instance, Japan, every time there's a new person diagnosed, the 14-day quarantine resets. What would it take for that to happen at LACLA?
I have not gotten guidance from CDC about if the quarantine period would be extended or what circumstances would qualify for that. I think that we want to do a thorough contact tracing investigation first. We want to do a risk assessment and find out who may have had a high-risk exposure. As I mentioned, this individual was a solo traveler, so it doesn't look like there are family members immediately who were with them that might be at risk. And that is actually a relief because it means that there may not be other people who have a high-risk exposure. If we decide that the quarantine period needed to be extended, we would, of course, provide an update on that.
So at this point, February 20th is the date that they'll all be released?
February 20th is the date that we are tracking for release.
Yeah, so let me again reiterate the message that our operations has been working seamlessly, and I'd like to recognize our council member in District 4 to deliver that message for our community.
Thank you. Thank you, Mayor, and thank you everybody for being here. On behalf of the residents of District 4, which I represent, I want to let you know that this community has had a great response. We have had calls from District 4 residents who are concerned, of course, rightfully so. They are more concerned with the folks that are on base, and they want to make sure that they are being treated with the respect that they need. We know that San Antonio is a compassionate city. We know that San Antonio always steps up to the call of duty, and we are here. We are Military City, USA. We are confident that our military members are taking every precaution to be careful and make sure that nothing disturbs our community and the health of our community. So I am proud to represent District 4. I'm proud to represent the folks over at Lackland Air Force Base. I do want to repeat this message in Spanish for Spanish media. Estamos aquí en la ciudad de San Antonio porque es una de las ciudades más compasionantes de todo el mundo. Estamos aquí representando a una comunidad fuerte que se une y no tiene miedo a nada. Y vamos a ayudar a nuestros ciudadanos americanos que estaban aquí, estaban en China, estaban en el epicentro de toda la epidemia. Los trajimos a casa, los estamos protegiendo, estamos trabajando con nuestras instalaciones militares, con nuestros líderes comunitarios. Tenemos una respuesta que es ejemplar ahorita para todo no solamente el estado de Texas, pero todo el mundo quizá. Estamos tratando a estas personas con compasión, con dignidad y vamos a seguir haciendo todo lo posible para que nuestras personas se sientan bien, se sientan como que son personas humanas, son seres humanos. Quiero repetirles que si ustedes tendrían familia, si ustedes estuvieron en China, ustedes quieren que sus familias que tengan cuidados. El gobierno nos trajo a nuestras personas para cuidarlas. So again, reiterating the message that the mayor and the folks here have said, these are people from the United States. Our military, our CDC, our entire federal government are taking care of our own people. We are responding to the call of duty as usual, San Antonio, and I'm proud to be a San Antonian. And thank you so much for the media for spreading that information correctly. So we know there's a lot of misinformation that can happen out there. We know that there's a lot of miscommunication. I want to thank the media for getting the message out so that people do not panic, so that people understand what the message is and what folks need to hear. So on behalf of the residents of District 4, thank you for your concern, and I will turn it back over to the mayor. Thank you, Mayor.
I know you're not saying which hospital this person is at, but can someone talk about what is being done at that hospital to make sure it does not spread to
Sure.
a vulnerable population?
Yeah, and we'll take that question, and then I'm going to refer any additional questions, technical questions, to the folks that are up here in individual one-on-one. So go ahead, I think you're up.
The hospital that is housing this patient has them in a negative pressure room, meaning that air does not flow out, it only flows in, and they are in isolation, and people who go in to take care of that patient are in full protective gear.
And will that person be spending 14 days in that area?
That person may spend more than 14 days in that area if they are sick enough. I think the key is that you have to monitor them, and you have to do additional testing to make sure that they clear the virus.
Do we know how sick they are? Like, what's their current condition?
I don't have an update on the current condition. They were ambulatory when they left, and they're getting excellent care.
Thank you all very much, and anyone up here is available for one-on-ones as well. Thank you all for coming.